It's Dr. Jim Chappuis from Spine Center Atlanta, and what I want to talk about today is, do I need a back operation? No one wants spine surgery or back surgery, and I'm sure so many of y'all have friends that have had surgeries that didn't go well. So I think the big question comes to whether or not I need it to start with. So as a spine surgeon, there's basically three indications for surgery. An indication means, in medical terms, a reason to have surgery. One is a progressive neurologic deficit. In other words, you've got weakness that's getting worse and worse in your arms or legs. Second is bowel or bladder dysfunction. That can be, as we get older, that can also be a urologic problem. But again, that's another indication for emergent surgery. The majority of surgery is done for what we call intractable pain that's failed to respond to conservative measures. Conservative measures means physical therapy, chiropractic care, injections, time, medications. And if you're in that category, which most people that have surgery are in that category as opposed to the first two, then I think the question you have to ask yourself, first of all, have I had the full gamut of conservative care? And by that I mean, have I had injections such as epidural blocks, medial branch blocks, radiofrequency ablation? Have I had good chiropractic or physical therapy? And, even with some of the alternative measures, like we have acupuncture here. For me, if I'm going to have a back operation, I want to make sure I've tried all those things. The other question I ask my patients is, how's your pain today compared to 6 months ago, 3 months ago? If the pain's getting progressively better, then obviously we don't want to do surgery. If the pain's getting progressively worse, then I think the question comes, do I want surgery? Do I need surgery? Well, as we talked about earlier, if you don't have a progressive neurologic deficit, you don't have bowel and bladder dysfunction, then it's not an emergency that you need surgery. You're going to be having surgery because your pain's getting progressively worse and it hasn't responded to conservative care. Now, the other question I'll ask my patients, which is what I would ask myself, is how bad is the pain on a scale of 1 to 10? And then how many days a week is it that bad? Also, I would ask myself, does this pain interfere with things I need to do, such as taking care of my family, working? And if the answer there is, well, I can get by, then does it affect the activities that I just really like to do? I may like riding a bike. I may like walking, running. Now, some of those things I would encourage patients to stay away from. But the real question is the pain affecting the activities that I need to do and that are part of my normal family function? And for me to have surgery, it would have to be that the pain has gotten to that point that it's affecting those things. So that's kind of just a little rundown of how we don't really want to talk about the exact operations today. We have other videos that discuss that. I just want to talk a little bit about when is surgery indicated on my back and what are things that I would consider before allowing someone to operate on me. Thanks for watching, and you can find us on SpineCenterAtlanta.com.